Hi, thanks for joining me on the show. And I'm really excited to learn more about Lunaband and what you're building there.
Well, thank you for having me. This is a great opportunity for me to come here and speak with you. So, Lunaband is a company that I founded just recently, and it was basically to help address a common problem that dentists face every day, and that is to place fillings that are on teeth that are right beside each other. So right now, the fillings or restorations, as we call them, or back-to-back restorations, are done one at a time. And what that does involve is placing matrix bands, which are small little metal pieces that are placed in between teeth that help form the shape of the tooth. So we have something to place the filling against. If you have two right beside each other, you have to put two bands in. The issue with that is that when you do the fillings and you take the bands out, you end up getting an open contact because the thickness of the two bands, what it does do is it forms a open contact. So the problem, how do we get around it right now, is we put two bands in, we fill one tooth, we take one of the bands out, we go back in, we fill the second tooth. So the idea of the Lunaband was to place a single band that opens up into like a butterfly shape
Mhm.
and be able to fill the two fillings at the same time.
Interesting. And how did you come up with this idea?
Well, in all the years of clinical practice, so I'm actually a U of A grad from 1991 from the School of Dentistry here. So the years of practice, as well as now being on the faculty at the Mike Petrick School of Dentistry, I find that the students struggle with this concept of doing these back-to-back fillings. So the idea was there's got to be a better way. There's got to be a simpler way, saves time, is not so technique sensitive, is more comfortable for the patient, as well the ability for it to just be seamlessly be used with all of the other products that are used on the market right now. So it's just an addition to what is already out there.
Mhm.
It's just to help make things flow smoother.
Makes sense. And when would you say that this eureka moment was that, hey, I could do something about this and I have the skills?
Well, I think it was, this is not a situation that happens every filling, but when you do have those back to back fillings, every time it's like, geez, I wish there was something simpler. So I think when I found myself struggling at times in clinics, as well as watching the students now struggle, trying to get this ideal contact point between the teeth, I just thought there's got to be something. And that's when I decided that I was going to be the one to try and fix the problem.
Awesome. And when would you say you started the development or ideation?
So I started working towards a patent because I wanted to get my stamp on this idea and make sure that I had, the ability to develop it. So that started about 4 years ago, I think 4 or 5 years ago, shortly after COVID. Um, and then we kind of ramped it up in the last year when we've now developed a physical prototype as well. So my plan is to either go ahead and start manufacturing these Lunabands once we've got them Class 1 approved through Health Canada, or the other option is to partner with a manufacturer or distributor and have them take over, because a lot of these dental supply companies already have all of the facilities and all of the things they need. So either way is the way that we're thinking of going.
I see. And you said we. So who's on the team right now?
Well, I say we. It's
Hmm.
mostly myself. I do have my husband who helps with my business planning,
Hmm.
as well as my son who is quite good with financial analysis.
Hmm.
So he has helped me as well. But I mean, the actual development of the product has been just myself.
Amazing. And you said that you have prototypes. So were you able to contract that out to a manufacturer or were you able to build them yourself?
So I did have a contractor that I was working with, and I'm still working with, and
Hmm.
we are we just got the prototypes developed, And we're just looking for the next step, which is either to go towards the regulatory pathway or do we work with a manufacturer and a distributor.
I see. And what do you think in terms of the impact of the product? You know, are you able to save time or reduce discomfort for the patient or just create better outcomes in individual fillings?
So all three.
Uh-huh.
So you're definitely going to be able to place this butterfly shaped matrix band in between the teeth, replace or fill the two teeth at the same time, which is going to make it more comfortable for the patient. You're going to have less time smoothing and finishing the filling, which means when you save time, you're more efficient. When you're more efficient, you are probably going to be able to shave off, 50% of the time that you're doing these fillings, which is then going to allow dentists to be able to see more patients in a day, which will help with their bottom line, which is increased profitability.
Exactly, that makes sense. That's really interesting. Tell me now, how has the incubator where we are right now been able to support you as you got your patent and built a prototype and start looking into commercialization options?
Well, being connected with the incubator has really helped me develop contacts with people. I've gotten quite a few leads and had mentors that have actually helped me, going through the process of what is required, what are the steps, because just being a clinician, I didn't really know all of the steps that would be involved in actually developing a product. So the incubator has been great in that way, mostly for the contacts, and the mentorship has been amazing.
That makes sense. All right. Well, thank you so much for coming out and taking the time to talk about Lunaband. And yeah, we look forward to seeing you continue to develop and put this into every dental practice in the world.
Thank you. Thank you for the opportunity.
Of course.